Micheál, and just as we are cautiously reopening with outdoor hospitality in particular returning, I just want to commend all the businesses and the and individuals who are running such well-ordered establishments. I've had the opportunity to travel across Dublin Bay South a lot in recent weeks, and it's been really great to see so many places reopening and such general delight at being able to socialise safely again out of doors. And I do want to commend Dublin City Council for many of the great initiatives they're taking in terms of pedestrianisation of city centre streets, in terms of working with others for really creative use of public spaces. I'm thinking in particular of Rathgar Village, where you've got really great public seating accessible to all in the grounds of a church, run in collaboration with the council. However, in my own area in Portobello, we have had issues around consultation with Dublin City Council, and I'm certainly happy to be working with local residents now to try and resolve matters there and ensure that we can create safe and accessible public spaces that all can enjoy without encroaching on the rights of people to live peacefully in a residential area. And I leave it at that, but we are working on that. Could I, however, Leader, ask for debate in particular on maternity health care and on women's health, because while we are seeing this very welcome cautious reopening, there's been a real lagging behind when it comes to women going into maternity hospitals to give birth, where we're seeing that despite apparent agreement by the Taoiseach, the Minister for Health and the Chief Medical Officer, that restrictions on partners attending and accompanying women into hospitals should end or should at least be alleviated. Despite that, we're still seeing, and I heard even at this weekend, reports from women who are still in labour in hospital and yet cannot have their partners with them. And it's it has in some cases led to very distressing experiences for women, and it really does need to be addressed. And I would ask, Leader, that we might have a debate on it, and that indeed you might, because I know it's something you feel strongly about too, that you might contact the Taoiseach and the Minister for Health to see what can be done to ensure that if there is a directive that partners are allowed in, that should be complied with in maternity hospitals in a safe manner. And just to say also that clearly this is at a time where there's huge public concern that I share about the proposed governance structures of the new National Maternity Hospital. And this is a matter that's been allowed to continue for far too long, and we haven't heard reassuring intervention from the Minister for Health on it. So again, Leader, we might have a debate on women's healthcare, in particular on maternity healthcare and the new National Maternity Hospital in this House. I think it would be a useful and constructive way to engage with the Health Minister on these issues. Finally, I do just want to ask for debate on an international matter. I know colleagues will have shared the same deep concern that I and others felt on hearing the Amnesty report from last week about the dreadful abuse of Uyghur Muslims in China, the awful systematic horrors that are being perpetrated on this small minority population in a region of China. And, Leader, I would again ask that we might have perhaps just a short debate with the Minister for Foreign Affairs to express our deep concern about this. Thank you very much.